Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss and answer the question, can you put a pillow under your knee after knee replacement surgery? So where does this question come from? So when people are sleeping, a common thing to do when you're going to bed, when you're sleeping at night, is to put some pillows under the leg for a little bit more comfort and being able to sleep a little better. And early on after knee replacement surgery, we're really focused on knee extension or knee straightening range of motion. And the reason for this is there's a lot of research out there that individuals who are able to restore their extension or straightening early on after surgery tend to have really good outcomes and really good benefits and overall success with knee replacement surgery. So when people go to sleep and we put a pillow under your knee, so for example if you put it, I'll use the white one, if you put it directly under your knee like this and you fall asleep in this position, your knee is in this flexed bent position, and what can happen is you can develop some stiffness from being in that position all night, and that's going to increase that stiffness, increase that knee flexed or knee bent positioning, and possibly have some detrimental effects on the knee extension or knee straightening ability. So what people recommend instead, therapists and doctors, is put the pillow lengthwise like this, so you have it under your calf, under your knee, under a little bit of your heel, and actually use multiple pillows to start to give a little bit of elevation when you're sleeping and have that knee and have your lower leg up above the level of your hip. And so now you see that even though there is a little bit of flexion, a little bit of bend still, it's not perfectly straight, but it's a lot better than what it was with the pillow directly under the knee in that much more flexed, much more bent position. Now, there is a little bit of a caveat to this, and before I get into that, be sure to click that subscribe button below and turn on the notifications if you are interested in all things knee replacement surgery, questions, exercises, frequently asked questions, recovery, rehab, everything else in between. I post videos every other day. Now, the caveat to this is that some studies have come out that have actually shown a benefit of having the knee in a flexed or bent position when you're resting early on after surgery. So these studies looked at anywhere from 24 to 48 hours after surgery to up to a week, that first week after surgery, and they had individuals when they're resting have some degree of flexion or bending in the knee, so anywhere from 30 degrees or 90 degrees of bend in the knee when they're in a resting position. And what these studies found were some good short-term benefits from this. So they found that there was decreased swelling, and they also found there was decreased blood loss post-op after surgery from having it in a flexed or bent resting position. And they also found that there is some short-term benefits in terms of improved bending or flexion range of motion. Now, the thing that is a little frustrating is they didn't look too intensely at knee extension or knee straightening range of motion. So we don't know if this bent position is going to have any positive or negative effect on the knee extension or knee straightening range of motion. All that put together for the take-home message for you is early on after surgery, potentially in that first 24 to 48 hours, worrying about having the knee straight, perfectly straight, might not be that important. And actually I would recommend those first couple of days after surgery, just find the position that is going to be comfortable and that you can tolerate when you're trying to sleep or when you're resting. And so if that means there's a little bit of bend in the knee, that's perfectly okay. Now as you move past those first 48 hours and that first week after surgery, that's when you want to start to make sure you're focusing on getting that knee relatively straight when you're resting. So again, not putting the pillow directly under like this, but putting the pillow lengthwise so there's a little more extension, a little more straightening. And probably just as important, if not more, trying to get a little bit of elevation as well by stacking up some pillows. So I hope that answered that question for you. It's a little bit of a confusing topic and has some different answers depending on how you look at it and who you talk to. But I hope this gave you a little more clarity. I thank you again for watching. Please be sure to subscribe if you're interested in videos related to knee replacement surgery, preparation, recovery, rehab, exercises, and everything else in between. Thank you very much for watching.